Welcome back. I'm Sarah Lentini, and you're listening to Business Voice, a program of the Greece Regional Chamber of Commerce, sponsored by Bartolomeo and Parato Funeral Home. It's my great pleasure to welcome back to the show Dr. Stamatia Destounis, who is one of the forces to be reckoned with at Elizabeth Wende Breast Care, an organization that in some ways needs no introduction, but that nonetheless I'm going to ask her to talk about a little bit because we may all know just a rarefied slice of Elizabeth Wende Breast Care. And for starters, I know you've got more than one location, which people may not realize. But welcome to the show, Dr. Destounis.
Oh, thank you so much for having me back. Hello, everyone. Yeah, so I'm one of the radiologists at Elizabeth Wende Breast Care. And we're very excited because we actually have a Greece location that people may not know about. It's on the Greece Gates border, right off Long Pond Road between Spencerport Road and Ridgeway Avenue. It's at 3 Sheridan Place, Suite 200. So we've been there for a while, and, we offer our standard of care, which is the 3D mammograms. We've been doing that since 2011, since they became FDA approved. It's the better mammogram. But we also have additional services that we can offer our patients, such as screening ultrasound if the patient has done breast, and also DEXA, bone density examinations. And, we have offices. Our main facility is on Sawgrass Drive, and we do MRI there and obviously all the types of different needle biopsies if patients need. But we also have offices in Webster and Geneseo, Batavia. So we're, even the northern country, we're up in Carthage. So, Elizabeth Wende Breast Care has been around for a long time.
Yeah, and is in lots of places, more places than I realized. I knew you were in multiple places, but that's a longer list than I realized, so that's great to know. And Elizabeth Wende has been around a long time and has a fairly important history, correct, in terms of bringing the entire country's attention to the need for testing. Is that correct?
Yeah, so, Wendy Logan Young started the practice in 1975, and it was the first freestanding breast clinic to offer patients their results the same day after they had their mammogram. Wow. And, we have the radiologists, all of us are subspecialists, so we're all trained in breast imaging. We're all fellowship trained that now work there ever since, Wendy retired years ago. And we've continued, that kind of thinking of the patient is first, and we certainly communicate with our patients, and if they have concerns, we see them and we talk to them. And when we do needle biopsy procedures, because we need to diagnose an area of concern that we may see on the mammogram or on ultrasound or that we see on MRI, we call the patients with the results. So we've continued that, that thinking, that forward thinking, that we are the clinician for the patient's breast. And we offer all the newest and greatest type of technology, whether it's the 3D mammogram, whether it's the screening ultrasound for women with dense breasts, whether it's the breast MRI for our high-risk patient or our newly diagnosed breast cancer patient. So we offer what is the newest out there. We research everything. We do our clinical research. We evaluate new technology, and if we think it's valid and valuable, then we bring it into our offices.
Wow.
And we utilize it at all the offices for our patients.
That is really impressive. I didn't realize that you were researching new technology all the time as well. I mean, it's a great thing for you to be doing, but that's a whole other endeavor, right?
Right. Yes, it does keep us busy.
I imagine.
Absolutely.
Yeah. And radiology is no easy job, is it? I mean, you really need to know what you're looking for, right?
Well, so radiology does encompass at the whole entire body. So radiology is, a very interesting field, and you definitely have to, understand anatomy and understand biology and lots of different things. And so now most of us have become so subspecialized in different areas. So if you're coming to my office, one of my facilities, whether you come to the Victor office or the Greece office or the Batavia office or the main facility on Sawgrass, all I do is breast imaging. So you're not going to be getting a chest CT at the same facility or a bone X-ray. We are all we specialize in is the breast. And, for us, that keeps us very busy because there are so many different conditions, many of them benign, that affect the breast tissue, and we're well-versed and very familiar with them.
And how are we doing when it comes to getting the word out and having an impact on women so that they get tested early and impacting breast cancer and catching it early and keeping women alive? How are we doing?
So, we know that there's so much great technology out there. There's many tests that have been, researched and come out, and they may be helpful in a certain subset of the population. But screening mammography has been the test that has been around and tested in many large trials for many decades. And that's the only test that has been proven to reduce cancer deaths, breast cancer deaths. So what we need to get the word out and continue to do so through the healthcare providers that take care of the women, and through the, social media and informational websites, and also face-to-face meetings with every patient, it's to educate them about the importance of screening, that you don't want to palpate something and then come in, because you're feeling something in your breast. You want to come in for that routine mammogram yearly so we have the opportunity to find it the smaller size.
Yeah.
Because since there's no cure for breast cancer currently, the smaller we find it, the better it is, and that ensures the best prognosis for the patient and minimal surgery and minimal type of treatment. And then we're around for a long, long time to take care of our families and keep working and do the things that we want to do, So a breast cancer diagnosis is certainly not a death sentence now. We're finding tiny things, especially with the tomosynthesis, the 3D mammography, very, very small things. But we do need to keep getting the word out that women have to come every year, and it's from 40 every year.
Age of 40.
Not 50 every few years. And don't stop at 75. My mom is 83 years old.
Oh, wow.
She runs circles around me. So, she is, a valuable member of our family and her community, and she's healthy. So if you're healthy, finding something small in your breast, whether you're 75 or 78 or 83, it's minimal surgery, outpatient, minimal treatment or no treatment, and then you can live another several years as women are living longer and longer. And you can live healthily,
Yeah, live well as opposed to just live.
Exactly.
Yeah.
But now the thing with COVID and the pandemic has made many people, delay, postpone their screening. Or, maybe they're nervous to come in and have a screening examination. Or they're thinking, I'll do it next year. Let me just skip it this year. And because I don't want to go in, I'm nervous about, is everything clean? Is everything safe? People are nervous now. We have yet one more problem to think about.
And have you guys been functioning through, all this time? And are people able to come in and get screenings? How have you navigated the COVID landscape and helping your patients?
So the COVID landscape has been tough, so we did actually close for a short period of time in order to prepare all our offices for social distancing and recreate the waiting rooms and create workflows that work for the staff and the patients. So the staff had to be trained, and all the patients now do not wait in the waiting room. They come in, they have their mammogram. All our offices are open for screening or for diagnostics. If you have a concern or a problem, call our office and we will see you. But we're doing things a little differently because our first thought always is to our patients. So we have protocol changes. We're doing daily cleaning on, of all the areas, the common areas where the staff and the patients are. We obviously are sanitizing everything that's touched by the patients and the staff. We are scheduled appointments now that are further apart, so there are fewer people in any of the offices at any one time. And we disinfect and sanitize everything that the patient will touch. And no one's waiting in the building. We don't have any visitors that can come in anymore. If the patients live a long distance, they're given the opportunity to wait in their cars. And then we will call or text or email and with the results, so they don't have to leave to drive, a long distance and find out maybe we need to do another test or one more image or an ultrasound. So we have come up with ways to make sure that our patients are safe. All the EWBC staff is wearing masks. All the patients are required to wear masks while in the office. And, the other thing that we're doing is we're checking and we're pre-screening and screening every patient to make sure there are no COVID symptoms, because if there are, then we cannot see them. And all our staff is doing daily screening to make sure they don't have any symptoms.
So you really covered all the bases. That's fantastic. And sounds like you did that early on, so you've been able to continue to see people. And importantly, for folks that are listening, it sounds as though all of the Elizabeth Wende breast care facilities at all the locations that you mentioned are open for business. Is that correct?
Exactly.
Awesome.
Yes.
Yeah.
So the patients can call the main number, which is the 442-2190 number. And if they live near Greece, they can go and get their mammogram there. If they live near Victor or Batavia or Webster or Carthage, or Geneseo, they can go or the main facility, because we do have, patients that come to the main facility, so they can come to wherever they want, whatever's closer for them. Things will be a little different. So check-in is a little different. The arrival times are staggered. Our waiting room seating is spaced out. You will not see a lot of people around in the building, and the results are done a little differently. So you may be waiting in your car if you live a long distance, or you'll get a text or an email or a call from us saying everything is okay. You'll get your results as soon as we can, the same day, typically within a few hours of your appointment.
Yeah, which is so important, because it can be, a very anxiety-producing kind of a process, right? So,
Absolutely.
that speaks to health too. The less stress and anxiety you have to go through, especially, if you are sick, the less likely you're going to have a negative outcome. All those stressors are actually very bad for us. So that's wonderful that you do that. Yeah, it really is wonderful.
I hear you.
Yeah,
I know. So we're trying to make it as painless as possible, and we deep clean throughout the day all the exam rooms, all the waiting and common areas. We disinfect anything that's touched, by anyone, and everyone's wearing face masks.
That's
like
great.
I said, so we are doing serious cleaning to make sure everyone is safe.
Yeah, that's wonderful. So it's great to hear that people don't have to be putting off this service. I know there are other kinds of services that, at least a few months ago, or over the last couple of months, that people were not able to access.
Right.
And this one, it sounds like it's important for them to know that you've been available to them, and you continue to be, and that you've got all the best protocols in place, and there's really no excuse for not going to get your mammogram, which, as you said, you need to get from the beginning with the age of 40, correct?
Right, exactly. Age 40 and every year, and it just takes a few minutes, and that's just peace of mind.
Yep.
And if there is something there, it can be identified as soon as possible, because really that is what is giving the best prognosis, is to find something tiny. It's easy to remove surgically. It's outpatient type of surgery.
Yep.
Patients don't have to go through lengthy, painful treatments, and it's just minimal type of treatment, and you're good to go.
Yep.
And so we are here to tell you, we're here to welcome the patients. Come in, don't delay your mammogram, and we're here for all the breast needs, so of any woman or man, because some men get breast cancer also.
Right.
So, but the reality is, what we deal with every day is not breast cancer. It's a lot of benign things, but those are also very anxiety-provoking, right? Whether it's a skin change, breast pain, a lump that may be a cyst, a fluid pocket, or a fibroadenoma. But those are all things that need to be evaluated also to make sure that they're okay. So we don't want women or men to sit at home and worry about things, come in and get it evaluated.
Right. And it's pretty darn painless. It's pretty quick. It is something one shouldn't be putting off. And as you said, you've made the case very eloquently that it is, and very persuasively that it is. It will save if somebody does have something that's starting that needs to be taken care of. It saves going through a much worse ordeal if it's left to grow and not checked and not taken care of. So we thank you so much for what you and everybody else at Elizabeth Wende Breast Care do day in and day out in the community. And thank you especially all of you for continuing to provide services during this difficult time and figuring out how to protect yourselves as well as patients, which it sounds like you've done beautifully. And thank you so much for coming on the show again, Dr.
Oh, thank you for having me, and thank you for being there and providing information, for everyone to listen to and learn. And this is a wonderful program, and thank you for having me be part of it.
You're very, very welcome. Dr. Stamatia Destounis from Elizabeth Wende Breast Care, which has offices throughout the region, not just at Sawgrass, which is, of course, the mothership, but also in the town of Greece and many, many other places with all kinds of best technology that really is available. I didn't realize until today how much research you do to keep everything as modern and innovative as possible. So thank you again, Dr. Destounis, for coming on Business Voice.
Thank you so much.
All right, don't go away. We're going to be right back with my next guests, and it's a wonderful program. You don't want to miss them either. Don't flip that dial.